Hi, I'm Dawn Morse. I'm the founder of Core Elements Training. At Core Elements Training, we deliver an accredited day CPD course in dry cupping therapy. So our course is available as face-to-face delivery or as live online delivery. So in this short video, I'm going to demonstrate vacuum cupping or dry cupping to the plantar fascia region. So this is an excellent modality to use with clients that might be suffering from plantar fasciitis, or also if you're wanting to treat the bottom of the foot because your client may have suffered an Achilles tendon strain or strain in the soleus or the gastrocnemius area. So before we start applying the vacuum cups, we need to apply the medium first. So for the purposes of today, I'm using lotion, but you could also use oil or wax as well. And we need to apply a little bit more medium than we would do normally if we were doing manual massage. Okay, so a nice amount of medium over the bottom of the foot. And then from here, we're going to apply the vacuum cups. So depending on the size of the client's foot will depend on the size of the cups that you're going to select. You're going to need to apply a lot more suction to the plantar fascia region or the bottom of the foot than you would do for other areas of the body. So for other areas of the body, generally you're going to use around 2 to 3 or even 1 suction pump. But on the bottom of the foot, then you'll probably want to go for anywhere between 5 to 7 pumps because of the structure of the tissue here. Also, the vacuum can release quite quickly, so you will need to reapply extra suction into the cup. So ideally 1 cup around the calcaneus area, and depending again on the size of the foot, you might get 2 to 3 cups onto the area. Okay, so once we've got those cups on, we could then try doing a variation of soft tissue release. So in this instance, the cups have been placed on in a static position whilst the foot is, or the muscle group is, in a relaxed and shortened position. Then from here, I'm going to lift the foot slightly, and then we're going to draw the toes back to stretch the bottom of the foot. So if your client has good body awareness, they might be able to do this themselves by drawing the toes up towards the top of the foot. Or alternatively, we're going to do this ourselves as the therapist. So we're doing soft tissue release in the passive motion. Okay, so once we've stretched the bottom of the foot anywhere between sort of 4 to 6 times, that should have helped to trigger a stretch reflex in the muscle tissue at the bottom of the foot. So then from here, we might then be able to take it into a slight sliding motion. Okay, but sliding on the plantar fascia is going to be small movements because most people at the bottom of the foot, there's an awful lot of tension into that region. So we're going to take our time to move around the whole of the bottom of the foot with that small sliding motion. And if the cup comes off, which it normally does quite often on the bottom of the foot, then just to reapply the cup back to the area. So anywhere between 5 to 7 pumps, and then that small sliding movement. Okay, then once you've finished, you're then going to flush out the bottom of the foot with that effleurage technique. Excellent, so I've quickly demonstrated static cupping, a variation of soft tissue release, and a small sliding movement to the plantar fascia region at the bottom of the foot here, which is an excellent way for helping to treat clients with plantar fasciitis or foot conditions. If you'd like to find out more about our accredited day CPD course in dry cupping therapy, then please visit the website, which is www.coreelements.uk.com, and also you can follow our YouTube channel. Thanks.